Tambra Stevenson. I'm the founder and CEO of WANDA, Women Advancing Nutrition, Dietetics, and Agriculture, but I also serve as an area advisory board member for USDA and also serve on the DC Food Policy Council. But my most important role is a mother. I'm a mother of 2 children who just graduated this week at an unsafe and at Washington School for Girls. Just like food, I travel across the city for good education. But I also know that we have assets in our communities, and our fellow colleagues have repeated all problems. We know that in Frederick Douglass, My Bondage, My Freedom memoir, published in 1855, he talks about food being weaponized, how we have more liquor stores flowing in our communities than we have healthy food access. This is what structural inequities look like. Policies create that. Policy, like media, is a social determinant of health, which is why I'm a PhD student at American University studying media technology and democracy, because the way in which we frame our communities in the media and public discourse shapes our public policy. We see that with criminal justice. And that is why today, you being here in our community is vital to help shape the discourse and how policy, as the White House Conference comes together this September. I want to focus on a few solution ideas. Under WANDA, we understood that while big Black farmer issues have permeated the media, we have also an issue that has not permeated the media. Only a New York Times article a few years back touched on the issue about nutrition. As Secretary Gossack has said, we need a nutrition security action plan. As a former national security scholar, I understand nutrition security is national security. And so when I think about the need to invest in human capital, I see that we have less than 3% registered dietitians of African descent, 10% people of color, period. And when you think about going to a war, if you do not have enough troops on the ground with the resources and equipment, what are you going to say? You're going to lose the war. And we're losing the war in America and in this city, and in my home state of Oklahoma. And I want us to win the war. And so I ask, imagine the room in 1969, were you all present, your ancestors present? No. So I say we must have a seat at the table when this upcoming conference comes about, because it's our faces and our voices that will change the discourse and the future for our generation when it comes to food policy in this country. So the work at WANDA is threefold. One, education. That focuses on the WANDA Academy. We created the Academy with the support of Sibley Memorial Hospital, DC Healthcare Finance, understanding that we needed a hybrid learning solution, and I took my experience being a former extension agent at UUC and understood that we need to modernize programs like FNEP and SNAP that's not really talked about when it comes to SNAP Ed, and leveraging technology. And I had just had this conversation at the Urban Extension Conference at Rutgers just a few weeks ago. And so what we're doing is showing what could happen to an FNEP or SNAP Ed by doing it in our own communities, connecting women who are on Medicare, Medicaid, and those who are not, because one thing that I found out is that regardless of your socioeconomic status or education, we lack nutrition literacy, not only in this community, in this country. At my school, at Oklahoma State University, and also when I was a student at Carlisle High School, we were required to take agriculture. I was a future farmer of America member. Cows were across the street. Understanding where my food came from was so natural. And so coming here to raise my children and not seeing this disconnect puzzled me. And I said, we must bring women and their children to Black farmers, seeing women who are growing food, going to a Amanda shop, coming to Mary's Future Shop, and knowing that we're not just simply consumers, we're producers in our community. And giving them access to also the food-food connection, grief therapists, people who died, and how we self-medicate and eat during the course of the pandemic. That all played a critical role, and people realize that it's not just about physical activity. It's about cooking for change in ourselves and our communities that's vitally important. The second is advocacy. Not only do we serve on multiple roles with Tough Food Innovation Council, but we also serve in a way that makes coalitions think about issues that they haven't before, such as the conversation on food as medicine. There are health insurance companies that are trying to strategize what that should look like, creating black boxes, Asian boxes and American boxes. But I don't look at, as a researcher, what do I see? I look what is missing. And what is missing is that as June is National Soul Food Month, if we didn't know, there is an omission that our culture does not have value. And if we're trying to take businesses like that was soul food businesses that once were here and were able, we cannot demonize that has been happening in the media when it comes to soul food, or remix those recipes and make them healthier, take them back to the original African heritage diet that we know that was mostly vegetarian to begin with. And equip those community members, which is what we do in the WANDA Academy. The other part is being able to testify on issues like nutrition equity, being in front of not only DC Council, but also federal policy issues, to make sure that when our voices come around the nutrition issue, that we talk about the need to make human capital investments. And that means investing in people and democratizing nutrition in a way that we know not everybody will have the opportunity to even fill a slot for a dietetic internship, because the way the system is rigged, half the people who are coming out with nutrition degrees can't even fill a slot to begin with. And so that means we have to rethink how we educate people in this country around nutrition education. And it's not just child nutrition. It's about adolescent nutrition, it's about maternal nutrition, it's nutrition across the lifespan, down to geriatric nutrition. That is what's missing. And the last part is innovation, leveraging technology to help us scale up and build these concepts of online marketplaces, making sure that people know that there are businesses like Dairy and Amanda that you can support. And so that is why we've created programs to ensure that we have access. We will be launching not only the Juneteenth celebration that you all are invited on June 18th, when it comes to the Sisterhood Supper, but it's an opportunity to, one, honor local food sheroes in our community, and also bring women together to understand that they can be the change that they want to see in their communities by being a part of the conversation of how do we shape policy in our communities. One of the things we've acknowledged in our policy council that we don't have enough representation of our community members speaking up, speaking out, because they're not informed of how policy is playing a critical role. You can only do so much, eat less, move more messages, okay? At a certain point, you gotta change the policy. And that enables or disenables an environment for people to thrive. But if you've never been a part of having a seat at the table, how would you know? So you swing your wheels thinking you're making change when you're not. It's slow, incremental changes. We need, as Chris shared, a revolution. And so we're here today to ask, will you join this revolution? Will you join us at IamWanda.org? We will be creating with NWCP, our branch, which I also serve as a health chair, a new framework that focuses on our Black communities in a way that has not been talked about before. We have to put nutrition and integrate it with agriculture and community and culture at the nexus. And that is what we're talking about in our area advisory board, with so many of my colleagues are thinking about agribusiness, which is great. I have cattlemen, ranchers in my family, but at the same time, agriculture means nothing if it's not connecting to the nutrition, to make sure we have nutrition-sensitive agriculture in this country, and making sure that our communities are part of the future of ag and nutrition and the future of food. That is part of it.